So today we will discuss about the renal stone disease. Renal stone disease is another common kidney disease occurring in most of the people. It is if anyone gets a renal stone for the first time, throughout their lifetime they used to get more than 5 to 10%. They'll repeatedly get the renal stone disease. The stone the types will be different. It may be calcium stone, it may be oxalate stone, it may be uric acid stone, maybe xanthin stone, or it may be cystine stone. So the management of renal stone disease, if the stone is a smaller size, less than 6 millimeters size, it can be cleared by giving a high fluid intake, either by orally or by intravenously, by IV fluids giving it. We can bring it down. Second thing, any patient who has got a stone former should have a lot of fluids, because stone gets formed if the fluid intake is less. The crystals get supersaturated. They'll get sediments over the kidney. Once they get the sediment, keep growing and recurrently forms the renal stone disease. At the same time, if instead of 1 liter per day, if you increase more fluid and pass the urine output to 2 liters or 3 liters, this crystal will be in a dilute stage and sedimentation will not occur. So, patients with renal stone disease should have a lot of fluid intake, should have a protein restricted diet, should have a salt restricted diet, and oxalate stone people, the people who are passing oxalate stone, you must avoid oxalate containing foodstuffs like tomato, cabbages, ice creams, sandwich, chocolates, leafy vegetables, and strawberry, gooseberry. All these are rich in oxalate content. These diets should be avoided. But calcium stone formers, calcium is more common in milk, but there is no need for the calcium also to restrict it. If it is restricted, it will form the other type of stone disease. Then uric acid. Uric acid is a stone which can be radiolucent stone. If somebody has got a uric acid stone and severe pain, take a plain X-ray abdomen, it will not be seen in the X-ray. It is a radiolucent stone. But those people should have a alkaline urine. Alkaline urine, uric acid will get dissolved. It will not form crystals. It will cut out. That's why whenever anybody has got a uric acid stone, you must give them like soda bicarb or Scholl solution. Any one of these should be given to alkalinize the urine. Then calcium stones, to reduce the calcium stone, you can give the thiazide diuretics, which will decrease the calcium excreted in the urine and thereby reduce the stone formation. So for the calcium stone, you can give thiazide diuretics. Oxalate stone, you can give the diet restriction for the oxalate containing foodstuffs. And further tablet pyridoxine, that is B6, can be given in the large amount. Number 3, uric acid, for them you must try to give them the seafood should be restricted in those people, and in those people you must have a lot of fluids as well as alkali, like soda bicarb can be given in the form of tablets or Scholl solutions. Like this we can give it and then reduce the frequency of stone formation. The largest stones that is stuck in the ureter or bladder should be removed by the urologist either by URS and lithotripsy and removal, or by doing a nephrolithotomy and then remove it, or by doing a ESWL, extracorporeal shockwave lithotripsy. By that you can remove the stones, because by passing the light with sound waves, you can break the stone inside the pelvis, and so that the stone will get washed out in the urine. So these are the ways we can clear the stone disease. Stone disease forms another contribute about 5 to 10% of the renal failure as contributed by the renal stone disease. Thank you.